Hello, this is Muriel Bowser. May is Older Americans Month, and in DC, we are so proud to celebrate our most senior and seasoned Washingtonians. This month, we celebrate at a moment filled with hope. Our lives were turned upside down by the pandemic, but now we see the light at the end of the tunnel. So, the first way I want you to help me celebrate Older Americans Month is by making sure all the seniors in your life are vaccinated. If they're not, go to vaccinate.dc.gov or call 1-855-363-0333 and help them pre-register. And throughout the entire month, let's continue finding safe and fun ways to honor all our neighbors who have spent decades making Washington, D.C. the greatest city in the world.
Hi, everyone. My name is Laura Newland, Director of the DC Department of Aging and Community Living. Welcome to Mayor Bowser's 10th Annual Senior Symposium. I'm really excited for our Lunch and Learn session today, Reimagining Living Boldly in the Era of COVID-19. I know a lot of you have been wondering, how can I truly live boldly in a pandemic? Well, one thing is for sure, some of you have already been doing just that. You've adapted to new ways of living, learning how to navigate new technology like Zoom and FaceTime, and keeping active while staying safe in your own homes, thanks to online programs on DACL's website and through our friends at the Department of Parks and Recreation. You continue to engage with us, joining our Call and Talk program and reaching out whenever you needed us. These days, vaccination is widely available, and we know how to keep ourselves and each other safe. So today, as we reimagine how to live boldly together, get ready for what I know will be a great conversation with some incredible leaders who have been at the forefront of the district's public health emergency. Please join me in welcoming DC Health's Dr. LaQuandra Nesbitt, the DC Department of Parks and Recreation Director, Director Delano Hunter, and AARP DC's State Director, Louis Davis Jr. Before we start the conversation, many thanks to AARP DC for partnering with us to host this year's symposium. Louis, thanks for being such a great advocate for our seniors. Please share a few words.
Honorable Mayor Muriel Bowser, Director Newland, thank you for inviting AARP DC to be a part of this important annual event. AARP DC has a long history with the Department of Aging and Community Living in a partnership that helps make the 50+ communities in the district only stronger. The advocacy and community outreach that AARP DC does is not only for our 83,000 members, but on behalf of every older adult and their families in the district. The need to combat social isolation is more apparent than ever. While AARP has not been able to do in-person events in the last year, and up to now, we have been working nonstop remotely with our volunteers and local partners, providing all variety of quality online events of reliable information to help people stay safe, find a COVID-19 test, then find a COVID-19 vaccine, and stay socially connected all at the same time. AARP will continue to lead and support advocacy efforts to protect and expand access to programs and services that district residents 50 and older need to live their best lives where they choose. Thank you, Laura.
Thanks so much, Louis. All right, let's get started. So, panelists, each of your organizations plays a unique role in helping seniors thrive in the communities they know and love. As we move closer and closer to getting back to normal, can you tell us what Live Boldly means for seniors in the work that you do? Dr. Nesbitt, can we start with you?
Sure, and thank you so much, Director Newland, for having me. It's always a great time to be with our seniors here in DC in an intentional way. I often get to connect with them when they're on Zoom meetings with my staff. For me, I've just been tremendously excited about the potentials that we have to be a new and reimagined DC overall. And so from a health and wellness and a health and safety perspective, we know that many of our seniors have been vaccinated, over 74%, and they're ready to get out there. And we're ready to have them get out there too, and reconnect with their families and their friends. In your opening remarks, you mentioned the thing that is most salient to me is that we haven't always given our seniors, our seasoned residents, the credit they deserve for being able to adapt for being able to use technology in new and innovative ways, and all of the vibrancy they bring to our community. So in terms of living boldly in the future, I think we can just continue to take things to the next level in terms of how our seniors thrive, whether it be how they access their health care, how they participate in community health and community activities throughout the city, and being active in the recreation space. So tremendous opportunities ahead for all of us. Thank you.
Awesome. Thanks so much, Dr. Nesbitt. And I totally agree with you. I think we need to give our seniors in our community such great credit. In some ways, I think they have managed this past year plus better than a lot of us who aren't seniors. So Director Hunter, let's go to you. I know DPR, this is where fun happens. So why don't you tell us how DPR supports seniors in the community to live boldly?
Thank you, Director Newland, for the invitation. And I also want to thank Dr. Nesbitt and her team for their leadership and their collaboration during the public health emergency. And I would be remiss if I first didn't speak to the important emergency supports that DPR has provided to seniors and the district as a whole during a public health emergency. While our is, of course, recreation, we've had to step outside of that zone to provide these important supports, from grocery delivery to homebound seniors, to hosted COVID testing locations and vaccinations through our partnership with DC Health. I'm incredibly proud of my colleagues at DPR. The last I've checked, we've administered working with DC Health, over 40,000 vaccinations have been administered at DPR locations, including our fair share of seniors through some senior-only sites in the very early on of days of vaccine distribution. And also, we've distributed over 300,000 meals over the last 12 months, which include homebound meal delivery to seniors. And we launched a new program called Feed the Fridge, which provides restaurant quality prepared meals in our facilities, including some of our high traffic senior locations like Fort Stanton. So I'm incredibly proud of our team for providing these emergency supports. Now, to answer your question specifically, we haven't forgot about our core mission of recreation, and I'm proud of some of the programming that we have provided. I would say our most popular would be our lap lane swim reservations and our fitness center reservations. We have service over 11,000 residents on a monthly basis through these reservations. And we certainly have our fair share of seniors. And also we've dabbled in online platforms and online classes as well. Our jury making class has been particularly popular amongst our seniors, and also our Young at Art class has drawn quite its fair share of seniors. I think to date we've registered or we've served about 1,300 seniors through our online programming, and we're eagerly awaiting reopening and being able to engage our seniors more full force in our traditional core recreation offerings.
That's awesome. Thank you so much, Director Hunter. DPR is just such a critical part of our senior community in DC. And so I love hearing about everything that you've done to support critical needs during the pandemic, and looking forward about how we can imagine build back better and stronger together as a community. It's really great. So Louis, let's go to you. What does Live Boldly mean to AARP in DC?
Sure, thanks, Laura. AARP's mission is to empower older adults to choose how they live as they age. That's what we've done for 62 years. By either building it ourselves or partnering with other local organizations, we've been providing regular online programming that connects the 50 plus to fun, fulfilling, and educational activities. Living boldly means having the wherewithal to live as good a life as one can at any age, to live where one wants to live, to be connected to family and friends, to have your own voice heard, or at least a trusted ally who will speak and fight on your behalf. AARP has been that wise friend and fierce defender for 62 years, and we're showing no signs of stopping now to do what we do for the 50 plus and their families.
Awesome. Thank you so much, Louis. Our advocacy community is so critical in making sure that our entire community is supportive of seniors. And Dr. Nesbitt, I want to get back to you because I know we talk a lot about vaccination. The mayor talked about vaccination in her intro, and you are the most trusted person we have in the city to talk about public health. And in fact, you're a national leader. So what is DC Health doing to help dispel the myths of the COVID vaccine among our older adults?
Sure. Thank you so much for that question. We've been at it for a while in terms of making sure our community was prepared for vaccinations beginning last fall before the first vaccine was approved in the middle of December. Our charge here is to meet people where they are and go wherever we're needed to share facts and to dispel myths about COVID-19, both the disease and the vaccine. We participated in countless virtual town hall sessions hosted either by, we did one early on with DACL. We've done some with many of our faith-based organizations, our civic associations and civic groups, as well as partnering with healthcare providers to be able to ensure that we can have one-on-one touches with people when we need it to. So all of that has been a critical part of our strategy. Recently, we've launched even more of an initiative that's a bigger and bolder Senior Buddies program. I know some people may be familiar with the Senior Buddies program that did a door knocking campaign in Ward 7 and 8 and in some parts of Ward 1, focusing on our Latino residents to be able to answer any questions and to help navigate them through the process of vaccination when we were requiring people to pre-register either by phone or online. Now we've got a new effort that puts even more volunteers and feet on the street to answer any questions people may have about vaccinations and to let everyone know that they can walk up and walk in without an appointment to our vaccination sites across the city. So lots of opportunities for information sharing, lots of opportunities for our seniors, all of our residents to get vaccinated when it's convenient for them now. And we're going to keep pushing in that vein. I will want to take this opportunity to make sure everyone knows that we do have a program that connects with homebound seniors. So if you're homebound or have a friend who's homebound, they can give us a call and we will be able to schedule a time to come to their home and to give them their COVID-19 vaccine. So there's opportunities for everybody to get covered throughout the city. Thanks.
That's awesome. Yeah, we want to make sure that no one is left behind here. And actually, when I think about living boldly, the first step has to be getting vaccinated, right? So I know you and I both have a lot of conversations with seniors in the community. And one question that I get a lot is from seniors who are vaccinated, but they're still really nervous about in-person activities because they're not sure if other people in the activity is going to be vaccinated. So what would you, Dr. Nesbitt, say to them?
I'll expand upon that because, we focus a lot on whether or not our seniors are comfortable and our seniors are ready to come outside now that they've been vaccinated. But we see that in all age groups, that it's been a very different year, often challenging for people. And folks have done such a tremendous job of protecting their health and protecting the health of their loved ones. But we also reminded you at the beginning that our way out of this and our light at the end of the tunnel were vaccinations. And the vaccines that we have reduce your risk of being hospitalized and dying from COVID-19 by 100%. So it's really a great thing for people to begin to reconnect. Social interaction is the thing that keeps us going. And so you can feel free, you've been vaccinated, to go out and to spend time with your friends and family, to do things safely indoors and outdoors. You can go for those walks in the park, the walks around the corner. You can share meals with people. Those things are possible to do now. And I will say, when we passed out flyers, that signage that had people have the ability to put a sign on their door and say, when you come into my house, you have to wear a mask. We want people to still be as bold and brave to say, if you're going to come around me, you've got to be vaccinated. So it's okay to ask. It's okay to ask your circle what their vaccination status is. And some people may get vaccinated because you create the terms and conditions that says you can't hang out with me unless you have a vaccine. So don't be afraid to make that declaration and to encourage people in that way.
Peer pressure is always a positive way to go with public health outcomes, isn't it?
Absolutely.
Louis, DCL has always been proud to partner with AARP on behalf of our city's oldest residents. Can you tell us how AARP has been working with other DC agencies and community stakeholders to galvanize and support seniors, especially during this unprecedented time for all of us?
Sure. Thank you, Laura. In all of last year, like every year, we fought to protect senior budgets, and we come alongside you to do that. We help to make sure that your department has all the monies it needs. In 2020, we led the fight to suspend involuntary discharges from long-term care facilities, and for virtual visitation options so that people could visit a loved one in a nursing home. We fought to maintain a moratorium on shutoffs of consumer utilities. And we think that in that way we demonstrate that we're a wise friend and a fierce defender that we are. Since 2020, we've done AARP town halls, 8 of them, covering long-term care rights, how to stay safe, the disproportionate impact of COVID-19 on African American and Black and Latino communities. We've done these with Dr. Nesbitt here, with yourself, Director Newland, and Dr. Shelley McDonald Pinkett of Howard University Hospital. To reach Latinos, we've had a great partnership with El Tiempo Latino and Jackie Reyes, our very own at the Mayor's Office of Latino Affairs Director, and Dr. Elmer Huerta. And we reached over 10,000 Latinos in those events with El Tiempo. To shine a light on the impact of COVID-19 on Black-owned businesses, we teamed up with Denise Rolock Barnes, the publisher of the Washington Informer, Antoine Ford, who's the CEO of the Greater Washington Black Chamber of Commerce, and Stacy Lee Banks, who owns our phenomenally loved Lee's Flower Shop on U Street. These are just some of the ways that we engaged in 2020. With the Legal Counsel for the Elderly at the District Attorney's Office, we did a 4-part series helping people to know how to avoid COVID-related scams that were happening and their long-term care facility rights if they had a loved one in a long-term care facility. And it was an election year last year. And like every election year, AARP, which is staunchly nonpartisan, we give it our all to help people 50 and older, especially 50 plus voters, know where to vote and the issues that are in front of them. And we hosted several online voter education events with DACL, with the DC Board of Elections, the Washington Informer, and again, El Tiempo Latino. And at AARP, community service is such a high priority that all staff are given paid time to allow them to do volunteer work in their community. And I took advantage of that, and I'm proud to say I worked alongside the DC Board of Elections. I think they did a bang-up job last year, and served as a precinct captain, or what we call a precinct captain, but a election day captain in the general election. And that was a phenomenal way that our organization helps us to give back to the community that we call home.
That's awesome. Thank you so much, Louis. And volunteerism really is just a great way to stay engaged, no matter what is happening out in the world. So I appreciate you bringing that up. Director Hunter, okay, so you've really said a lot about what DPR has provided during the public health emergency and what you guys have lined up for as we move forward. So you and I are little similar this way, I think. We're both kind of excitable. So let me ask you, what are you most excited about when it comes to senior programming?
I would say we're just chomping at the bit to return to recreation. And we recognize it's going to be a process, and we're committed to a safe return of recreation, and will follow all of the guidance provided by the CDC and also DC Health to ensure that with whatever we offer, we're doing it as safe as possible. I can tease, I'm excited about it all. To be quite honest with you, I can tease a few things that really kind of get me going, that are keeping me up at night, that are motivating me through the day to prepare for. I can tease that our outdoor pools will open on Saturday, May 29th. We're really proud of that. I think 2020 may have marked the first year in, I don't know, maybe 70 or 80 years in the district that we did not have outdoor pool access. So we're really excited about that. And I know it's a popular spot for many of our seniors. For our indoor pools, we'll likely do away with that reservation system, which we know is a pain point for seniors. It has been a pain point. That'll likely go away towards the end of this month. And we'll start to slowly reintroduce our in-person senior programming, especially in our aquatic facilities. Our senior water aerobics, our Body Wise program, our shallow swimmer, our senior water exercise, those are really, really popular classes that we look forward to reintroducing this summer and into the fall. And also outdoor sports like pickleball and senior softball. Those will likely expand in spring and in the summer. We get a lot of calls and inquiries about the Senior Olympics. As you know, we are a part of that National Senior Olympics. And right now, we know that is not something that will return in 2021, but folks still want to engage in those sports. So whether it's pickleball, softball, you'll see more of that in the coming months. And also there are partnerships that we're launching that I want seniors to participate in. I'm really proud of a partnership we have with DC Central Kitchen to provide over 750 bags of groceries, healthy and nutritious groceries on a weekly basis. So if any seniors are interested in that, I would encourage you to call DPR's Customer Care Center at 202-673-7647 to learn about it. We're moving it around the city. I think we started off this week in Edgewood in Ward 5, and then we'll move it around to various locations around the city. So that's just a few things that I'm really excited about that I know that our seniors will be excited about in the coming weeks and months ahead.
So all of the district seniors can consider 2021 as a training year for our Senior Olympics, and 2022, all the other states better watch out, right?
That's right. That's right. That's right.
Thank you so much. And I love how you guys are doing a mix of both fitness and nutrition wellness, because we know those two things are so closely connected. So really appreciate all the work that DPR is doing there. Okay, so now we're going to welcome some of our senior representatives to the discussion. We have senior leaders from across the district joining us today to ask questions on behalf of our older residents. Thank you to everyone who submitted your questions to us in advance. If you have a question, but you didn't get a chance to send it ahead of today's Lunch and Learn, please email us your question at dacl.communications@dc.gov. That's dacl.communications@dc.gov. And someone from our team is going to get back to you really soon. So I'm really proud to introduce our senior representatives. We have Commission on Aging representative and our chair of the commission, Ward 8 Commissioner Guilford Bobo, Commission on Aging Ward 1 representative and our vice chair, Commissioner Carolyn Matthews, our Hattie Holmes Senior Wellness Center participant, Miss Barbara Early Allen, and a DC Senior Advisory Coalition member, George Kerr III. Okay, so Commissioner Bobo, let's start with you.
This question. Come on, bud.
Commissioner Bobo, are you there? If you're there, please unmute. There you go.
This question comes from Ward 8 resident, Ms. Gwendolyn Green. Ms. Gwendolyn Green asks, what does employment look like for DC residents over the age of 60?
That's a great question. So thank you so much for that, Commissioner Bobo. I'm happy to address this on behalf of DACL, and I invite any of the other panelists to jump in if they'd like. I definitely have heard from the community over the years that so many older adults are interested in contributing and earning an income. So the mayor has invested $11.4 million in a new senior wellness site in Ward 8, which is going to be located at Kramer Middle School in Fairlawn. The anticipated open date is fiscal year 23. And our vision with that site is that at least 50% of the staff operating the site will be district seniors. As we look to reopening in the coming months, we're also working with all of our providers, encouraging them to hire district seniors where there's a need for more personnel. For seniors who are looking to contribute on a volunteer basis, we've been in conversations with all of our grantees on developing more volunteer opportunities to help build connections in the community and combat senior isolation. So I encourage everyone to stay tuned as we continue to develop these opportunities. All right. I don't see any of the other panelists unmuting here, so let me move on. Oh,
Actually,
okay.
I
Director
would.
Hunter.
I'll put in the plug for our seasonal positions each year in order to effectively operate and safely operate our pools and our camps. We hire over 700 seasonal workers. And in fact, if you're interested, I would encourage our seniors to log on to careers.dc.gov or DPR.events. We do have hiring fairs that are coming up, and we're still looking for camp counselors. So if you are interested in working with youth and you want to do that for 6 to 8 weeks, we're looking for folks. We're hiring close to 700. So that's an immediate opportunity to earn some income and do some good for our communities.
Yeah, and I'll add to Director Hunter's comments. You know, we're sort of trickling down in terms of some of our hiring, but about 6 to 7% of the staff that we hired to serve in the DC Contact Trace Force during COVID were age 65 and older. And that's not a negligible number when you're talking about having hired hundreds of people. We're looking to how our community-based organizations will be hiring community health workers and outreach workers to help connect on a peer-to-peer level to help even more people get vaccinated across the city. And as I mentioned before, we've always seen our seniors and residents, any resident who wants to work, as being the right kind of person for us in these significant roles that contribute so much.
Thank you so much, Director Hunter and Dr. Nesbitt. And I just want to reiterate that if you're 60 and older, there's a place for you. We have job opportunities, we have volunteer opportunities, so please definitely reach out. And Dr. Nesbitt, I just want to say thank you for using our DACL mug. I just saw you taking a sip from it. So I hope everyone who's watching this is enjoying that as part of this senior symposium. Okay, Commissioner Carolyn Matthews, our Ward 1 representative. Vice Chair Matthews, are you there? If you're there, please unmute.
Can you hear me?
There you are.
Okay. Thank you. The first question that I have, this question is from Ward 5 resident, Ms. D. Powers. Upon reopening of senior wellness centers, will members be required to show proof that they have been fully vaccinated? If not, why not?
That's a great question, and I'm glad Dr. Nesbitt is here too. I know we have a lot of concerns about reopening in the safest way possible. So at this time, and in working with DC Health and the mayor's team, we are encouraging as many residents as possible to get vaccinated. It's one of the most important steps to get us closer to reopening. And we're continuing to work out all of the details of how and when we're going to reopen safely. When it's time to reopen, all of the information, policies, and protocols are going to be communicated so participants can make informed decisions on how they want to participate. So as Dr. Nesbitt said earlier, it's absolutely acceptable to ask, are people vaccinated before you enter into any activity? We are confident that with our providers and opening our senior wellness centers in-person activities, that we are going to provide a safe environment for everybody. Dr. Nesbitt, I don't know if you want to jump in there. Correct me if I got any of it wrong.
Sure. And, I really want people to be reassured and comforted. We want as many people to get vaccinated as possible. Our rates or the amount of COVID in our community continues to decrease. If you personally have been vaccinated, you have a degree of protection for yourself, and you have protection that can confer to other people because you're less likely to spread COVID. So we want folks to realize that it's going to be okay to go into programs, activities, senior centers, restaurants, malls, with you being vaccinated, even if there isn't a requirement that 100% of the other people have been vaccinated. So go ahead, get out there. All of the rules that we publish from DC Health are designed to make sure that everyone is safe.
Thank you, Dr. Nesbitt. And, one of our earlier conversations, we talked about how a lot of the participants in DCL programs and DPR programs, actually, we think are vaccinated probably at a higher rate anyway, because everyone's so eager to get out and be active, right?
You're absolutely right. We found that our the early adopters for our vaccine program were those folks who were in the workforce, who were heavy into volunteerism, who were part of social clubs and social networks, and they were not only doing it for themselves, but helping to bring their friends along with them to the same appointment time, same location, speaking very openly about their experience. And as I mentioned before, 74% of the district seniors are vaccinated. And the percentage that still remains, we believe some of them are folks who are homebound that we have to get to, who often participate in DACL activities virtually or using some of the new technologies that both DPR and DACL have put in place with the videos on Channel 16. So there's a host of things that are going to happen in different ways for people to be engaged. But again, if you've been vaccinated, we really have a high level of confidence that it's okay for you to get out there and to be active in the community in a number of ways.
Awesome. Thank you so much. Commissioner Matthews, do you have another question for us?
I heard that I had been muted. Am I unmuted now?
You are unmuted now.
Okay. The next question is for Dr. Nesbitt from Ward 1 resident, Ms. Sandra Steele. I and many of those closest to me have been vaccinated, but my youngest relatives are not yet eligible. Do you know when children will be able to get the shot and what the process for that will be? Thank you.
Sure. This is a very timely question. Beginning tomorrow, every district resident 12 years of age and older is eligible to be vaccinated. There was recently the Pfizer vaccine was authorized for us to give to children between the ages 12 to 15. So now all of our adolescents and older, from our middle-aged adults to our seniors, everybody is eligible for vaccination. Here's what I know. I know that our seniors have done the best job of getting vaccinated in our community. 74% of our seniors have had a dose of vaccine. When we look at the younger population, and when I say younger, even 20 to 44-year-olds, it's about 40% of that population. And all of us appreciate the wisdom and the guidance of our seniors. We do as they do, as well as what they say. And so don't be afraid to be ambassadors and connecting with the members of your family, the members of your place of worship who are younger, and really helping them understand how important vaccination is for our community as a whole, and sharing your personal stories in terms of why you chose to be vaccinated. And I'll repeat it again. You can set conditions with them in terms of how much time you're going to spend with them. And that just might be the motivator that some of them need in order to go ahead and to take their shot.
That's great. Thank you so much for that, Dr. Nesbitt. We have our Ward 4 representative, Ms. Barbara Early Allen. Do you have a question for us?
Yes, I do.
Thank you. Go.
We have a question from two seniors, Mrs. Nita Alvarez from Ward 4 and Mrs. Angela Spencer from Ward 5. Both would like to know, when will the recreation centers be open again? And we know that Mr. Hunter has told us many things that will be coming to the forefront, and we'll think about May the 29th, but can you give us any more information?
Sure. Thank you for that question. Currently, our centers are open, of course, for reservations only for fitness centers and our lap lane reservations. It's a process. It's a gradual process. So what you'll see, the next wave of openings will happen on Memorial Day weekend for our pools, and then we'll start to reopen our facilities for camps in June, and also we'll welcome back some in-person program. As you know, the mayor made a big announcement on Monday, one that we are really excited about, but also we're continuing to work with DC Health, and there are some pending guidances that we are awaiting that'll govern those operations. But I do expect for some of our senior programs specifically, I know at Fort Stevens, I know if it's the same Angela, I think we're talking about Officer Spence from Ward 5 that's active at our Brentwood community. I know the great senior engagement that they have there, and we want to welcome them back as well this summer. So once we receive that guidance and we want to align our practices to it, we do expect a very active summer season. Normally, summers is all about pools and about camps. We recognize because we've had seniors that have not been able to access those facilities, in some cases in well over 14 or 15 months, we're going to go strong with programming this summer as well. So I would say stay tuned, more details to come, but you will see some in-person engagement and programming potentially as early as June.
Thank you.
That's great. Do you have another question for us, Ms. Early Allen?
Yes, you know it's for you, Dr. Newland, Director Newland. Mrs. Betty Wilkins from Ward 4 would like to know, when will the senior wellness centers reopen?
Well, thank you for that question, Ms. Wilkins. I actually got that question from Dr. Nesbitt just a couple weeks ago. So we are having the same conversations here. We're working with our providers right now who operate our senior wellness centers, and we're in close communication with DC Health and Dr. Nesbitt and her team. We're going to offer a few limited in-person activities starting in this month in May. And we have actually, DACL is sponsoring drive-up celebrations at some of our senior wellness centers on May 24th and May 25th. So I think you actually got some information on that in your symposium box. If you want more information, give us a call at 202-724-5626. That's 202-724-5626. So yes, we're going to have some in-person outdoor activities this month. And just like Director Hunter, we are really, really eager to get back to in-person indoors at our sites. So we're hoping for gradual reopening starting in June. And we're really pushing for that because we know people are ready. I'm ready to get out. I know our seniors are ready to get out and be active. And so we are going to work very diligently to open as quickly as we can, as safely as we can. And I know Dr. Nesbitt has been pressing and saying, look, our seniors are ready, Laura, come on, let's go. And she has been exhorting me to do that. And so we're following Dr. Nesbitt's guide here, because we've got to make sure that you all have an opportunity to get out of your house. It's been a long time. So get excited, get ready, and give us a call if you have any questions, but we are going to be in touch with our community about what to expect next. All right. We have our Ward 6 representative, Mr. George Kerr III. Mr. Kerr, are you there?
Yes, thank you, Director Newland. I have a question from Ward 6 resident, Mr. Chuck Hicks. What are the district plans for Gay Pride next month? I know Capitol Pride is sending out a press release shortly about this as well.
Thank you so much for that question. May is Older Americans Month. And of course, June, we roll right into June for Pride. I always like to say we celebrate Pride all year round. And we have been working on programming to make it available year round for older LGBTQ and allies, that will include entertainment and socialization, peer supported groups, happy hours, coffee hours. We know that our usual celebration at the Pride Festival and Parade is still postponed, but we're going to continue providing virtual celebrations and some limited in-person engagements throughout the month of June to celebrate. So continue to check our events webpage or reach out to us for what's happening and how we're scheduling it. We're not going to be marching in the Pride Parade, so we got to come up with a different way to celebrate this year. And I'm confident we'll be able to do that with the help of our community. So, Mr. Kerr, do you have another question for us?
Yes, the next question is from Ward 7 resident, Ms. Brenda Carroll. When will water aerobics resume?
Yeah, that's right. That's right. That's one of the classes that's really popular. Typically, we will do some of those classes during the summer. So summer, we do less programming, just pre-COVID, right? Because summer, the focus is on our outdoor pools. We expand from our 10 indoor pools to close to 32, including our outdoor pools. So we are looking at potentially doing some this summer, but the full complement will return this fall. And again, we plan to do more programming this summer just because we know that there are folks are eager to return. So we'll do more programming than we do during a traditional summer. So we're looking at teasing a few classes. We're still dotting our I's, crossing our T's, looking at our accounts to see what we can actually fund this summer. But your full complement will come back this fall.
Thank you so much, Director Hunter. I need to circle back. I'm told that I missed a question from Commissioner Bobo. So I'm very sorry, Commissioner Bobo. Are you still there with us?
Yes, I am, Director Newland. Thank you. My second question is from Mr. Demetrius Kinney from Ward 8. Would like to know if the following are available exclusively for seniors: swimming pools, senior jobs, adaptive bikes for adults with disabilities.
Okay, I think some of those are mine. I would say pools. We don't have exclusive use for our pools. Typically, they are shared. Now, when with our current lap lane reservations, that lane is yours, right? So you do have an opportunity to swim in that dedicated lane. That'll at least continue through this month. And after that, we think we'll go to probably strict capacity limits on our pools. And our outdoor pools, of course, are for the entire community to share. Jobs. We don't have senior specific jobs, but we do, again, we hire close to 700 seasonal workers, and already a fair share of our seasonal workers are retirees from either DC public schools or from DPR. So we welcome seniors. We think they add a great deal of experience and expertise to our summer operations. So that's something that's available for everyone. As it relates to the adaptive bike, that maybe someone can send me a specific question about that. I know we have that within our inventory. I'm not sure the specifics of the adaptive bike concern that the individual is referring to.
Thank you so much, Director Hunter. We got some questions sent in as well. And so, Dr. Nesbitt, you are very popular these days. We're getting a lot of questions around vaccination. Mr. Roger Curry from Ward 7 is asking, I hear a lot in the news about new COVID variants around the world. Will we need to get annual booster shots? And if so, what will the rollout for those look like?
It's an excellent question. Currently, what we are doing is we're monitoring how long protection lasts in people who have already been vaccinated, either in clinical trials or for those of us who were vaccinated very early on back in January, to make sure we still have antibodies. There is some promising news that suggests that the variants that are currently circulating in the United States, in particular, the variants that originated in the UK, South Africa, and Brazil, the vaccines that were already approved, the Pfizer, Moderna, and Johnson & Johnson vaccines, are all effective against those variants. So those variants themselves would not indicate necessarily a need for us to have what some people are referring to as a booster or a reconstituted vaccine. We also know that we have been able to spread out the population in terms of who was vaccinated when. A lot of that was because of the supply of the vaccine, and we needed to meet demand. So all of the people who are currently vaccinated, the 200,000 people who have had a dose of vaccine or so, didn't all get vaccinated on the same day. So we have an ability to be able to give people any additional doses they may need, like boosters or a new vaccine next year, within our existing health systems. So in our hospitals, our doctors' offices, all of our retail pharmacies have these vaccines. And that if we needed to do a big push, we could open up again, after they, sort of sunset, these larger high volume clinics. But there's going to be lots more places. We're adding more and more locations every day where people can go in and get a COVID vaccine without having to be in sort of the 1,000 people a day type of environment. So it's a great question. We're thinking about it too. Our job here is preparedness at DC Health. So we're going to be ready to take care of you all, regardless of what the science tells us in terms of additional doses.
That's great. Thank you so much for that reassurance. I have one more follow-up question about vaccination. Now, I'm going to ask it because I'm interested in this as well. This is from Ms. Alice Smith in Ward 5. Dr. Nesbitt, for the many seniors who have retired and their lifelong dream was to be able to travel any and everywhere, what do you envision the national and international travel environments will be in 2021 and going forward? I think a lot of us are actually curious about this question. Is it safe to go on road trips? Is it safe to fly? All that kind of stuff. Can you give us a sense from your perspective?
Sure. Sure. And we've provided some guidance on travel, and we're updating it to make it even more clear that people can get out there and get on the road. If you've been fully vaccinated, your risk of getting COVID-19 during travel is low. People who have not been vaccinated, so unvaccinated individuals, and I often think about this as vaccinated parents with young children or teenage children who aren't yet eligible for vaccination, there's a little bit more risk when that family travels together for the teens. The adults will be protected, but the teens and the younger, smaller children would not be. Currently, for international travel, there are still some restrictions or discouraging people to travel to certain places where the cases of COVID-19 are still much higher than in the United States, or where they may be experiencing a variant in those countries, not here in the US, in those countries that we haven't yet studied how well the vaccines that you've received work. So right now, domestic travel, it's great. Again, road trips are better than any time that you're mixing with a lot of people. Flying, it's more concerned about the airport than the airplane. So just be mindful of those types of things. But you can definitely get out there and start seeing your friends and family around the country, or just seeing all of those sites that you have on your list to see now that you've got more free time to do so.
Awesome. Thank you so much for that guidance. We are very close to the end of our time here. This has been an awesome conversation. I wish I could continue. I know our seniors are really engaged here. So let me just wrap up with this final question to all of you, and anyone can feel free to respond to this. One of the things that Dr. Nesbitt said in the beginning during her remarks was, how can we reimagine something better for ourselves as we reopen? And I'm curious, what is it that each of you hopes for as we move into the future and get back to a new kind of normal?
All right, Louis here, and I'd like to use this time and to thank you again, Laura, and put a plug in for May 25th. I didn't get a chance to answer George Kerr's question. We'll be celebrating at AARP. May is also Black Pride Month, and I'll be having a conversation with the CEO and Dr. DeMark Hickson of Us Helping Us People Into Living. That's May 25th. Watch our space in Twitter and Facebook, and you can get more information about when that takes place. I think it's all the things that we've discussed here. It's helping neighbors and friends to get out and enjoy the fresh air and their space in their own neighborhood. And I've been doing that here in the District of Columbia and in my own neighborhood here in Petworth. That's going to be the new normal. And some of what was normal, in fact, wasn't always good. Not everything that used to be is good. So it's a chance for people to reinvent themselves.
Yeah, I love that. This is definitely a time where we can take stock and ask, who do we want to be, right? I think it's a perfect opportunity. Dr. Nesbitt, Director Hunter, any kind of final thoughts on this?
Yeah, I'm really I'll stay in my health lane on this question, but I'm really optimistic about the new ways that our seniors in our community can receive care. We know it's often been challenging for people to make plans to go to the doctor's office if they have to arrange transportation. What could be a 30-minute endeavor often ends up being 60 minutes or 4 hours for many of our seniors who rely on others' public transportation or other subsidized transportation. The way that seniors have taken to telehealth and being able to connect to their healthcare providers has been awesome. And it's really going to help to keep them healthier in the long run by doing those telephone or video touches with their healthcare provider instead of making the trek to the doctor's office and only having to go in for a physical in-person visit when it's absolutely necessary. And I know that we've talked about telehealth for years, but now that people have actually used it, they're like, this isn't so bad. I actually like this more. So I'm really inspired that we'll be able to reach even more people with specialty care, behavioral health services, regular primary care checkups, all of those things without creating the transportation barriers that so many of our seniors and residents often face.
I would merge both of the responses from Dr. Nesbitt and Mr. Davis on this. First, over the last 14 months, we've seen an explosion of usage of our outdoor spaces. Everything from forest bathing to hiking to walking to exploring some of our trails in both the district owned and also those of the National Park Service in this area. And I hope that those will continue. I think that there's a newfound appreciation and we're also seeing different uses for these spaces. I would say secondary or tertiary properties that didn't get much utilization, now there are lines for. And I think this is going to lead to and spur more investment in these spaces that will pay dividends. So that's one thing. Even my own parents, my parents are seniors. My father is 81, my mother is 78. They're getting out. We're going to the park together. I'm doing one thing with my 3-year-old and my 4-year-old, and they're doing their thing, walking around the track. So I want to see that intergenerational use and also the usage of our outdoor amenities continue. Now, also with some of the I know we're all tired of Zooms and Teams and WebExes, and I look forward to not having as many of those, in the coming quarter or the year ahead. But we have seen that it is a way, at least, to keep in touch with folks. I'll give you some folks on this call may be familiar with Mr. Sorel Green. He is a senior and he works within our seniors division. And his most popular offering is his senior jury making class. And there are many seniors that are saying, hey, while I want to take this again in person one day, I really like these classes because I'm able to go back and then I'm able in my free time to be able to reference the lessons of what we're doing. And then that is helping me during some of my downtime. So I think that'll continue and that'll be good. So maybe we'll use this to supplement some of that in-person engagement that we are dying to get back to. So those are two things that I hope will be the legacy of this past 14 months, at least in positive ways that we want to at least continue going forward.
Awesome. Thank you so much to our panelists here, Dr. Nesbitt, Director Hunter, and Louis Davis Jr. For your thoughtful engagement and support of our seniors in our community. What I hear all of you saying is that these past 14 months may have been challenging, but we have seen our community respond in ways that we would have thought impossible before the start of that 14 months. And so continue to engage in new ways. Let's continue being creative, making the impossible possible, and not let limits get in our way of living boldly. I want to give a special thanks to our senior representatives, Commissioner Bobo, Commissioner Matthews, Ms. Allen, and Mr. Kerr for asking really great questions on behalf of your peers. And thank you to all of you for tuning in today. We hope you enjoyed this conversation, and I can't wait to hear from you about how you're living boldly. Remember to stay connected and engaged with us. To sign up for upcoming events or to learn more about DACL, be sure to visit our website at dacl.dc.gov or call us at 202-724-5626. Live boldly and enjoy the rest of Older Americans Month. Take care.
Thank you, everyone.